Yep, 1 minute past. Right, hello everyone. Thank you so much for joining us today. This is the second of the Learning Together for Better Lives seminar series. My name is Fanula, but I'll forgive Fanula because Fanula is a difficult one. I'm grateful for you sharing your time with us today. We are running this seminar series from the Health Determinants Research Collaboration, which is a group within the Council and its partners helping the Council become research active. If you want to know more about that, then drop us a line at hdrc@aberdeencity.gov.uk. Today we are hearing from Paul Manson. He is an information specialist at Aberdeen Centre for Evaluation at the University of Aberdeen. He'll do a brief intro, about 15 minutes, and then he's going to give us a demonstration. His topic is how to establish a good work-related research question and how to go about finding answers to such questions. After we hear from Paul, we'll also hear from Dr. Leo Ho, who's one of our research fellows within the Health Determinants Research Collaboration. And that portion, Leo is going to help contextualize and link things to council operations. You can see that you have access to a Q&A. We do encourage you to share any questions that you have there in writing as the session progresses, and other contributions that are not questions, you can share in the chat. Your mics and cameras are off just now, but they will be enabled in the general discussion section of the session. And the session is being recorded. With that, then I would like to hand over to Paul.
Thank you. Thank you. Thank you. So, as Fanula said, I'm Paul Manson, I'm an information specialist at the Aberdeen Centre for Evaluation. So excuse me, I'm on somebody else's laptop. How do I get up onto the slides? Okay, sure. Okay. Yeah, as you can see, I'm on Martin's laptop. I'm not really Martin. The talk today is going to be broken into two parts, as Fanula said. So first, I'm going to talk about the research question, how to establish a good research question. And then I'm going to talk about finding evidence, how we find evidence using some free resources. We're going to cover some general approaches to any search, a little bit about record keeping and why that might be important. And then I'll do a live demonstration of several resources, some example searches and how we go about that. So just briefly, so how do I end up being here talking to you? So the Aberdeen Centre of Evaluation, as it says at University of Aberdeen, we have three parts to the centre. So there's a clinical trials unit that runs clinical trials for the NHS. We also have a methodology work stream, which is about really about how clinical trials are run and the best ways to get good results from them. And I'm part of the knowledge synthesis programme, which is run by Professor Miriam Brazelli, who's also part of the HDRC. So the knowledge synthesis program, we essentially produce a range of reviews, mostly clinical, but they're moving into social care increasingly. We're also NIHR Evidence Synthesis Group, which is part of a new 5-year program to find evidence to support health, public health, and social care. Essentially, we'll do any kind of review that somebody's willing to pay us money for. So this is an example of some of the reviews that we've done over the past few years. So the first few are ones that we've done as part of the evidence synthesis group. And the last three there, the assistive technologies, subsidised public transport, and financial incentives or wage reduction, are ones that I carried out either working for NHS Grampian or for other collaborations I work with. So looking at how we set a research question, So the research question can be used either to define what you want to look for, or if you already have a research question, to clarify the different aspects of it. It's very useful for help with focusing your search and making sure that you're keeping the search on track, and also choosing the results that are relevant to your search. Because I'm part of an academic group that does nothing but reviews, we tend to find absolutely everything and then go through absolutely everything. But it's quite different if you're work-based. You need to be able to establish what things are immediately relevant so you're not overwhelmed. So things about your research question. So as I say, it defines or clarifies exactly what you're looking for. It needs to be practical in terms of the scope of the question. So you can't answer a question that's too big, that's going to have too much evidence. And you need to be cognizant of the time that you have and the resources that you can apply to it in a work situation. It should be original, so it shouldn't just repeat something that's happened. You might want to find something that's absolutely new, or you might want to extend knowledge of something that that works in one context, but to see if it works in another, or to get some sort of theoretical or extended background to it. Your search needs to be ethical. That is, that it shouldn't promote a particular viewpoint, or it shouldn't prejudice particular groups as part of your research. And it should be neutral as well. And what I mean by being neutral is that your question shouldn't anticipate the outcomes that you really want or do expect. And that's because if you start searching with your outcomes in mind, you might subconsciously change the search parameters to only get evidence that supports you, or you might use terms that only find results that support your viewpoint. As I said, I used to work for NHS Grampian. I was a clinical librarian, supported clinical staff. And the very first question that I was asked to look for was this one. So a group emailed me and said, we know that the PTB test is very effective for diagnosing patients with OM. Can you find evidence to support this? Now, first of all, we don't want to go for the PTB test is. You don't need to know where that is. Not straight after lunch, I can assure you. But they didn't mean anything by it. They used it all the time, and they just wanted to be assured they were doing the right thing. But a much better question would have been, what evidence is there for the use of the PTB test for diagnosing patients with suspected OM? We're just trying to find what evidence out there. Is it good or is it bad? Is it positive or is it negative? In actual fact, the PTB test doesn't work at all, which is what I found after a fairly extensive search. So just be careful with how you couch your search and what terms you use. When we are looking at search questions, it can be either very specific or they can be very broad. Both are applicable in the right situations, but they can have unexpected side effects. So for this example here, does attending football classes improve attentiveness in P4 to 7 children? So that's an extremely specific question. One of the issues might be there's hardly any information out there, hardly any evidence about it. But also, it's not very easy to apply that knowledge to anything else unless you specifically want to start football classes for P4 to 7 children. Going the other way, on a similar theme, in children under 16, does attending sports classes improve behaviour? So this might go the other way. There might be endless evidence on this. But even if there isn't a huge amount of evidence on it, because the range is so broad, you might find it difficult to bring all the evidence together and come up with a meaningful conclusion. The children under 16 covers everything from preschool children up to 14, 15-year-old teenagers. And they might have any different types of sports classes. It could be a gym Joey session once a week, or it could be swimming 4 or 5 times a week as part of a competitive club. So the range of sports classes and the range of behaviour might mean it's extremely difficult to get a meaningful result from it. So one of the ways of approaching setting the question is to use some question frameworks. And not every question will fit into these frameworks, and there might be more or less useful, but it's a starting point for you. So a very common question framework is the PICO framework. This is mostly used for clinical questions, but as I'll show you, you can break almost any question into these various facets, and it just allows you to structure your search. So the PICO is the population, intervention, comparator, and outcome. And as I say, it's typically used for clinical questions. So, for example, in patients with a migraine, are triptans or SRI better at reducing days off work due to migraine? But anything can be applied to this this format. So it's a question here. So for asylum seekers learning a new language, are group classes or immersive learning better when measured by the language comfort scale? So our population here is asylum seekers who are learning a language. Our interventions, group classes, our comparators, immersive learning, and our outcomes, the language comfort scale. Now, you might not want to put all of those into your search. You might sort of the asylum seekers with language and group classes or option. But once you've got your question set out, you can then start your search. You can add or subtract terms and still keep the search on track. And also, once you get your results, you can start picking out the ones that are absolutely relevant to you. A slightly broader frameworks, the PO one, which is the population, exposure, and outcome. And this is where you're not really testing something. You just want to see what the effect of an intervention or a way something's set up is. So for this question here, in homeless persons, how does the assignment of a named caseworker affect the rate of homelessness? So our population here is homeless persons. Our exposure is a named caseworker, and our outcome is the rate of homelessness. Now, ideally, we'd hope that it reduces homelessness, but we don't want to set out searching for reduction or similar terms, because that might it might mean that we miss out on some research. A similar one, again, on the PO one. So in preschool children, what effect does extended screen time have on oppositional behaviour? So our population here is preschool children. Our exposure is extended screen time, and our outcome that we're looking for is oppositional behaviour. Hopefully that's been measured. And a slightly broader framework that can allow us to look at, particularly look at different perspectives here is the SPICE one. So an example here would be in care homes, do staff think that music-based or non-music-based groups have a greater effect on residents' quality of life? So here we're getting the, in the care homes, we're getting the ideas of the staff. So not necessarily with how the residents feel about it, but with the staff being slightly on the outside and looking in, what do they think about the intervention? And again, you might not use all these terms, so you certainly be using care home setting as part of your search, music-based groups, and the quality of life and the evaluation. And a similar one with again with a setting. So again, how do teachers in secondary schools believe that class dynamics are affected by access to mobile phones? So again, in our definitely as part of our search, we'd have secondary schools or equivalent terms, and we're looking to see what the teachers think about it. So something from the point of view of the children might not be so relevant and would probably give you different results. And our intervention in comparison are mobile phone access. So in terms of actually the finding the evidence itself, the general approach to it, firstly, we need to be systematic. So even for a work-based search, or perhaps indeed particularly for a work-based search where you haven't got a lot of time to to go about it. It's very important to realize that the search process, the search itself, is a bit of a process. I think over the years have been spoiled by Google and the like, where you can type in almost anything you want into Google, and they'll give you a quick answer or immediate answer to something very easily. But if you want to find a range of evidence to support an intervention or to support a change in policy, you need to be systematic about it. Also, so kind of following on from Google, that for an academic exercise here, don't expect instant results. You probably won't get the perfect search first time round, so don't worry about it. And also, free resources don't tend to have very good search facilities, so you need to have a bit of trial and error about how best to search. You need a bit of time to do that as well. So don't worry that you're not getting something instantly. You will get there. Very importantly, work from your question. So always keep your question in mind, so that it keeps your search focused and keeps you a good idea with of the results you're getting and the ones that might be relevant to you. A very important thing in the kind of searches that you'll be doing, which aren't huge using very sophisticated searches, is checking references and citing documents for items that you do find that are very relevant. If we check the references and the references within the document, and also what a lot of databases allow you to do now is to check for more recent documents that cite the one that you're using. And I'll show you how to do that in some of the examples. And then when you have some results, you'll go through what we call a screening process, which is just filtering the results. So the first thing you look at always is the title, and some of your results, just by looking at the title, you'll be able to dismiss them straight away. Some of them you might have to go into either abstract if it's a journal article, or the short description if it's a report, and decide whether it's useful or not. And sometimes even then you might not be able to decide one way or the other, and you need to access the full text and decide which ones are going to be part of your review. And again, I'll show you how to access some of the full text as well. So the kind of results, so the kind of results you'll get from these searches. So one of the very useful ones would be reviews. So reviews where someone's already taken the question, they've already searched for the evidence, and they've compiled it and analysed it. So that's great if someone's asked either the same question or a very similar question to one that you're interested in. Case studies are practical examples of applying an intervention or applying some theory to a case. And they can be more or less directly applicable to your situation. And they tend to be very recent research, or can be very recent research, because it doesn't take quite so long to write up a case study and get it published. Reviews don't tend to have the most recent information in them, and they can be anything up to 2 or 3 years out of date because of the time it takes to compile a review. Obviously, official findings and reports. So these would tend to come from the websites of related organisations. So the kind of organisations I look at for health are things like the King's Fund and Health Scotland, the Joseph Rowntree Foundations. But those kind of areas will be the ones that you'll know best for your particular areas. A lot of the searches will also bring up books or chapters in books. Again, a very good review of information. A couple of the resources I'll show you will include electronic books, and the Knowledge Network includes some about 10,000 electronic books, so they might be available there, or they will be available there and then. It will also come up with some printed books, which we might be able to get hold of through the local NHS Grampian Library, which I'll speak to you about as well. And you might also find primary research, which is also sort of latest research on a particular topic. It might include new ideas or new ways to apply information. But because it's new research, it might not be very well supported by other information. So you're having to balance that, balance how new it is and how useful it is against having not very much information to back it up with. So record keeping is very important, even if you're not looking to publish something, just for your own benefit, and also if you want to present your report, if you've got a record of where you've searched and what you found, it obviously gives credibility to your evidence summary. Very importantly, it stops you going around in circles and searching the same place or using the same terms that didn't work first time, or forgetting what terms you searched and going back to do it. So having a record of what you've done is particularly important. And the kind of things you want to record, obviously you want to record the date of the search, the name of the resource, whether you use a basic or advanced search. And again, I'll show you the difference between those and how they can be helpful. The terms you use and where you search them, the fields you search. So some of the advanced searches will allow you to search in just the title or just the author or in the whole record, so you can find the words anywhere. You might want to record the number of results. That can be useful for your own benefit, because you can find somewhere that was really useful. You search several sources, but you find one that's really helpful on a particular topic. You might just want to make a note of how many results you found. It can also be useful as you go through your search. If you start off a search and have a huge number of hits, if you have thousands of records, and then you make a slight change to your search terms, and you suddenly find that you've got 10 or 12 rather than the 1,000 you had before, it might mean that there's been a slight mistake in your search, or even something as simple as a spelling mistake that hasn't been picked up. So if you keep an eye on the number of results, that could be very useful. And of course, you want to keep a record of all the results that you want to keep for further investigation or ultimately use in your review. So in terms of the resources that you can search, so all the resources I'm going to show you are all freely available to the public. The knowledge network you can register with, and that allows you to access more than the general public would. I will also produce a list of all the resources and the web links for you, so that you can access them again, and they'll be passed around after the meeting. The websites, as I said, the websites of relevant organisations are very important for reports and for official documents, and those sort of organisations are the ones that you know best from your own background. Lots of academic articles now are free on what's called open access. So for those now, the authors pay to get published, rather than you have to subscribe to a journal to get access to a piece of work. And really in the past, possibly in the past 5 years, it now say that the majority of academic articles are on open access, so they're freely available to anyone. If they're not freely available and they're on a subscription basis, then, as I say, the knowledge network, which you have access to, can let you access those. And it's very important with your searches that they show you what exists rather than just what you have access to, because there may be options for getting the full text once you found out that it actually exists. Through the university, we've a system through our university library that we can get hold of practically any article or any report from libraries around the world. But I'm not sure if the council has that exactly. Perhaps someone can pass that on. So when you come to actually carry out your search, some general points about the searching. So the search will normally cover the title, perhaps a short description, an abstract if it's a journal article, and it might perhaps include the authors as well. But importantly, what it won't cover is the full text. So you won't be able to tell immediately whether an article or report includes the terms that you're looking for, or if it includes it in the way that you're interested in. When you are searching, most search tools will automatically add your words together. So if you search for the words public library and libraries, it'll search for them both rather than searching for public or libraries. And it'll find them anywhere in the record, not necessarily next to each other. If you do want to search for a particular phrase, then again, most or probably all resources will allow you to search for that by putting them inside quotation marks. So if you're just looking for public libraries, you can search that way. And most resources, and again, possibly all of them, will allow you to use an asterisk to find different versions of a word. So the letters LIBRAR followed by the asterisk will find library or libraries or librarian or librarians. Some resources, so the ones that tend to have an advanced search, will allow you to use OR terms. So you can search for several terms at once. So if you want the home nations, you can find Scotland or England or Wales. So apologies to Ireland, I just couldn't fit it on the line. And again, some resources, again, the ones that tend to have an advanced search, will allow you to group things together. So you use a parenthesis and to group them together. So searching for something like fuel poverty and Scotland or England or Wales will find items about fuel poverty in any of the mainland nations. And again, in some resources, they'll allow you to choose where you're searching. So generally, they'll search in all the fields. But if you're getting far too many results, then what you can do is you can specify that you just want to search in the title for a particular term, and that's going to naturally focus the results to ones that are much more relevant. It might mean that you miss out on some if someone's been clever in the title or tried to be clever in the title. But the payoff is that you get far fewer results, and the results you do get will be much more focused. Not all of these tips apply to every resource, and I have to say that even I don't know which ones they apply to all of, and certainly you'll never know, and you won't have time to learn it all. But this is why I say that the first time you do a search, you might not get exactly what you want, but the search will involve a bit of trial and error, and you can make a note about what works. So I'm sure that some of you are asking this very question. Why not just use Google? And so first I have to say that Google is a wonderful resource and one that I use all the time, and I'd expect you to use all the time as well to find things. But we can't just use it when you're doing a search for what is an academic review or a work-based review where you want to say you found as much of the literature as possible. So the first thing about Google is, you just get whatever you search for, you get a huge number of results. And I have noticed that Google doesn't seem to give you the number of results any longer. So they've obviously stopped doing that. So no one could go through all the results. The results you do get are affected by the individual, either by your location or your previous search history. So they're not easily reproducible. They might not be reproducible by you, and they might not be reproducible by somebody else who wants to check what you found. The results, of course, include everything. I did a quick search for social housing, and the first few pages were actually just applications for social housing and how you go about that. So not really relevant to a literature review. Google isn't structured in the same way that some of the academic databases are, so it's very difficult to limit the searches. If you have got several tens of thousands of results, then you can't narrow it down very well. And there's no quality control in the results either, so you get results of any standard. Now, there is the option to use Google Scholar, which has a much more limited scope and does say it brings up academic results, and indeed it does. But you can still get a huge number of results, but they will be better quality and more appropriate, but you still can't go through them all, or it's unlikely that you'll be able to go through them all. Again, it's not structured, so you can't limit the searches particularly well. And you do get some questionable output sometimes. So I did a search for social housing, and it's a bit light colored here, but we've got 400,000 results. And it's automatically sorted by relevance. So the first two the results there are clearly very relevant. So that works, although you can't go through all 400,000. But if you wanted to sort them by date, for example, instead, and you just wanted the very recent ones, now I've only got 1,200 results. So the other 400,000 results have disappeared there. And in fact, it only brings back the results from the past year, and you can't change it, although it gives you the option here to change it. If you try to sort by date, that's all do. So Google certainly has its place, but it's certainly not the answer for an academic review. So the first group of results I'm going to show you are academic or evidence reviews. So someone has already looked at various pieces of evidence, and they've brought it all together. So it's great if someone's asked the same or very similar question. They tend to be around social care and health, but health is in its broadest sense, so anything really that can affect health. All the reports through this source are free to access, and there aren't very large numbers of items on these websites, so a simple search is normally enough for them. So these are the places I'm going to show you. I guess I'll send around a note of all these to you, and some notes about how to search them or what they're useful for. So I'm just going to change now to so just stop sharing. Oh, it's on the side, yeah. Yep. So our first one here is Cochrane reviews. So Cochrane reviews are really the gold standard of reviews. They're extremely large reviews with all sorts of evidence in them. So it's worth having a little look around the Cochrane library to show us what's available. So if we scroll down the page here, we have the option to browse by topic. So you don't even need to think of a search or think of a particular topic. So the topics here, I should make this slightly bigger. So some of the topics here that are relevant beyond just the medicine. So things like child health, the consumer and communication strategies is how to get messages across. We also the tobacco, drugs, and alcohol, and the public health as well. So the kind of topics under public health. So this first one's there. So interventions about promoting healthy behaviour through sporting organisations, or then school-based policies to do pretty much the same, target diet and so on. So you'll be able to access the full text of these if we select the one we want. And then there's a short description on the side here about a short description about the review and the results. And if you're interested in the whole review, we can download the full content. But as I do warn you, some of them are enormous. So we can also search in the Cochrane library. So just search from the front page. But I could do a simple search in the title, abstract, and keyword here. So if I search for smoking cessation, So I say lots of these will be medical interventions, but if we have a scroll down, so we have competitions for smoking cessation, mindfulness, and so on, and a one here just on general incentives for smoking cessation. And this one comes from January 2025, so it's extremely recent. Now, this is search for exactly for smoking cessation, but if you're interested in the topic and have a wider question, you might be interested in tobacco cessation as well. So much fewer here, so only 9 years, but with slightly different results here. So tobacco cessation for young people and so on. So it just goes to show that it's always important to have a think about different terms that you might use for searching. So the next resource here is the Campbell collaboration, and the Campbell collaboration is similar to the Cochrane. They produce rather large reviews, but their particular focus on social science and policy. And their search, so this search here is just searching the website, just for particular web pages. But you want to search under our work. And you can see the groups that they group their work under, so aging, children and young persons, climate, and so on. But we can search in here to do a simple search for housing. So we brought up some results for housing here. So again, kind of a short description of the review, the background, the objectives, and what the outcomes were, what the results were. And if you're interested in finding this review, the best way to do it is to use Google. Is to just simply highlight this and then do a search on Google. The next one's the Epicentre, which is based at the University College London. Again, they're evidence for policy and practice. And again, their search here, which is just search an actual website, but they have a list of publications. So they have a complete list and also a topic index. So we can go by topic. So again, a range of topics, adult education, childhood experiences, alcohol use, and so on. If we go to the early years in education, I can see the range of reports that they have in that particular area. And again, a short description of the report, and then a link to the full reference, the full report, if you want. And then the final one of these evidence reviews is the NIHR Journals Library. So this allows you to search across all of the NIHR. So this one is actually just about to change. So either next month or possibly in June, all the reports will still be available. All the reports will still be available, but the way they're presented might be a little bit different. But I'll show you just now that these things exist, and you should be able to find them later. So again, we can put our search term in here, and if we search this time for food insecurity, so we've got 8 results for food insecurity. And so this first one, child food insecurity in the UK. So most of the NIHR results will be related to the UK because they're sponsored by NIHR. And this one was actually produced by the Aberdeen Centre for Evaluation, but before I was there. And again, you can download the full publication or a short summary if that's all you need. So the next resource I'm going to show you are starting to get into more academic databases. And these have got slightly better search facilities, but they also allow you to access a bit more. So the knowledge network is provided by the NHS Education for Scotland. But health and social care, council employees can register to join it. So there's a register option up here. And it'll just a little online form for you to fill in, and you'll get a username and password available for that. Again, it's worth having a little explore of what the knowledge network has. So if we just scroll down the page a little bit here, we've got a social care portal. So it includes a section on professional learning and options for learning resources about different relevant topics, but also an option here to learn how to search the literature effectively, so you can check up on what I'm telling you. So also on the front page of the Knowledge Network, again, just beyond the social care, we've current awareness bulletins. So you can sign up for a current awareness bulletin, and each month they'll send you a bulletin on these topics, and they'll search the academic databases, including the subscription databases, and any relevant reports, and they'll produce a monthly report on these particular topics. So this is the latest one from March on alcohol harm prevention. And they have things on pricing, licensing, marketing, and so on. So again, if you want to search the knowledge network, because the search box is right on the front here. And if we want to search for public libraries and health, oops. So I'm going to show how clear it is. It's on the grey. There's 55,000 results for public libraries and health, searching all over the record. So what we want to do is obviously focus that. So if you go to the advanced search, so we can tell it where we want to search now. So we want to search in the title. And we want public. And again in the title, that we want to could search for libraries, or if we search for the phrase LIBRAR and an asterisk, that will find libraries, librarians, and library singular. And if we add a final line, again in the title, for health, so now we've got 700 results instead of our 55,000. They're automatically ranked by relevance. So the first one here is public libraries as partners for population health, health and public libraries, public libraries and COVID-19. So the search is working, and it's picking up the libraries and librarians as well. So if the 700 is obviously still quite a large number, but you can go through them. You go through the first couple of pages and identify the ones that are really relevant to you, or we can narrow it down even further. We can add another line, another search line, and this time we just want case studies. We want to see how public libraries have been used to promote health. And now we're down to just 23 case studies. And we can see that they seem to be quite relevant to our search. So what we can get here is you can access articles from the Knowledge Library, from the Knowledge Network that are free to access. So this one says it's freely available. And you can just click on it and get the title. If it doesn't say the full text is freely available, you can find one. So as I said, most of these are open access, so they're all fully available. If it's not fully available, you can click on the title, and it'll ask you to log in. And if you've registered with the Knowledge Network, then it'll give you access to it. The final one I'm going to show you is called JSTOR, and the advantage of JSTOR is it's a multidisciplinary database. So there'll be something in here, perhaps are all different areas where you work in. There's something like 10 million records in JSTOR, so there's a good chance that you'll find something on it. So there's lots of open access, so you'll be able to access it automatically. But also, if you register for a free account, you're able to read up to 100 articles a month online as well. So again, it is you got a simple search in the front here, but again, it is an advanced search where you can choose where you want to search for something. So if we search for fuel poverty, and we just want to search in the title, search for everything, and then see how many titles we've got. So it's 42 results for fuel poverty in JSTOR. And again, if it's available, there'll be a link to the open access for you to find. Now, because JSTOR is one of the more advanced academic databases, it'll allow you to add more into your search. So we want to search for poverty in particular, and then we want to find it in the home nations. So we can search for and again, search the item title. So with 200 results there on poverty in the mainland home nation. So as you can see, the results there are obviously very relevant because we've narrowed it down to the heading. So that's really a quick overview of how to go about your search. So I think the main thing to take from it is that it is a structured process. So if you're doing a review for a work-based review where you want to have a literature review, then unfortunately you can't just go to Google and have a quick response in Google. You do need to think about your search. You need to structure your question, and then from that structure your search and decide where you're going to search, and have a few test runs of your search as well in these different areas. The partly because the searches aren't particularly powerful, you will need to do a bit of trial and error. And if you can focus your search in the results there, you should be able to get certainly the majority of things should be available on open access one way or another. If you can't access it through the actual website, then take a note of or copy the title rather, and then just do a Google search, and good old Google will come up trumps. Okay.
That was ace. Thank you so much. We're just getting Paul. Yes. That was managing microphones and protecting us all from that awful noise of reverb. Thank you so much, Paul. I thought I was up to speed on academic literature searching, or I thought I could get by, but wow, I feel like there's a whole other layer of work to do there. And some of the things I noticed I thought were ace were PICO for structuring a question as a sort of a lay person trying to do literature searching. Breaking it down in that way and structuring it. And I saw the Cochrane Library lets you search by PICO as well. I think I spotted that tab along the way. That was really powerful. Before I hand over to Leo for his general thoughts about what might all this mean for from the council and its partners, there's been a question come through for you, Paul, about what are your thoughts on large language model searches, because the council is rolling out Copilot to quite a broad range of people. So, and you'll have to enable your mic for that.
Well, that's a very good question. You could ask me that on Friday, because I'm going to London for training day tomorrow on this very question. They are mixed at the minute. I'm no doubt ultimately they'll be very, very powerful. Oh, well, they are very powerful now. No doubt in the future there will be perhaps the go-to place. They're mixed just now because there are so firstly they are in the past. So even the most the most recent ChatGPT, I think, was something like 18 months, because it needs to be trained on resources. Our students sometimes use them when we're doing reviews to give them ideas and to give them structures and to give them prompts. So they're very good from that point of view. Maybe come up with things that you haven't thought of. They'll maybe give you places to look and evidence that they found. We know they're not infallible, and in fact, literally this morning there was an email came around our librarian groups about a nursing review that was published in a peer-reviewed nursing journal. And when one of the librarians went to follow up some of the references, and they found that 4 out of 6 references weren't real, and that's a known problem with artificial intelligence, that it creates incorrect references. Totally plausible, but not quite right. So there's a definite place for it, but it's at that beginning stage rather than producing a final result. You certainly need to take over you just need to review it critically.
Thank you, Paul. I would ask that you to stick around with us while we hear Leo's thoughts. But thank you so much for that session. I really appreciate it, and I'm sure our audience does as well. For the audience, be assured that the slides and resources will be shared with you after the fact, and this is being recorded. So Leo, what are you thinking about regarding this linkage to the council?
Yeah. Oh, yeah. So at the HDRC, we have been doing rapid evidence reviews with and for council officers on a variety of topics. topics. And this presentation is very relevant to my work. Actually, I've been doing reviews for several years, and I'm still learning every day. And well, actually, I've also been using large language models for searches as well. So basically, I just type prompts into Copilot and ask Copilot to give me, for example, like 10 references to support my argument. And most of the time, well, not most of the time, all of the time, uh, more than 3 out of the 10 references that Copilot gave me are basically wrong, or they just make things up. So I think using Copilot to search is still in a very preliminary phase, and we have to spend time on validating the results created by Copilot. So I would rather conduct searches myself instead of asking Copilot. But yeah, still, yeah. Thank you for Paul for his wonderful presentation. So, um, I have a question. So sometimes we want to have an answer for a specific question in a very like instantly, even though we can't. So, how many databases should we search for a specific topic? Like, do we need to search in like all of the 3 databases that you mentioned, like Cochrane and Campbell Collaboration and Epicenter, or we can just rely on one?
Yeah, so unfortunately, it's a bit of a how long's a piece of string sort of answer. So the things like the Campbell collaboration and Cochrane that have already made reviews, I wouldn't think that any of those would be enough on its own. Again, there'd be a good starting point, unless you come across exactly the right review, which is possible. I would certainly think that either one of the Knowledge Network or JSTOR would be enough, or PubMed, which is the provided by the US government, again, which is a health-based, but health in its very broadest sense, and everything related to health. So I think one of the databases allows you to search for individual articles would be better rather than any one of the review databases.
Right. Okay. Okay, cool. So okay, so if we conduct a search in Campbell Collaboration and we happen to find like maybe 10 relevant reviews, how do we select them? Like which one is better or which one is worse, or how do we make decision on the quality of the retrieved results?
Well, in terms of quality, so all of those, the Campbell, NIHR, and Cochrane, they've all been peer reviewed, so you can pretty much take them at face value that they've been done properly. You might want to still critically look at them and decide whether the research really has answered the question. Sometimes, probably not so much in the review, but sometimes in a single trial or a single academic paper, the way its answer doesn't quite answer the question that they ask at the beginning. But for any of those, you'd be able to take them really pretty much at face value and say that they were high quality reviews and they've passed the process.
Thank you, Paul. I really appreciate that. There's interesting reflections, and I think it's going to be picked up in a few different ways across the council. Certainly, Leo and the rest of the team with the research fellows are available for advice there also. What we'd like to do now is we'd like to open up for general discussion. You should be getting your mics and cameras activated so you can enable them if you want to. But now's your opportunity to ask the experts who are in the room with us. And if you are in the middle of formulating your question, you can raise your hand so we know to wait for you. Martin Murchie has raised his hand. Do you want to go ahead, Martin?
Hi. If I put my mic down, can you hear me? No, you can't hear me.
I can hear you. So can I.
Okay. All right, cool. I will go then. Hi, Paul. Thanks. I just want to kind of thank you for that. So, Martin, I'm director of the HDRC. So, just wanted to kind of personally thank you for it. And I don't think I've got a question other than my one about large language models. It was more just kind of observations following up on Leo's thoughts. So, we've got a lot of there's a lot of relevance to what you're talking about in terms of the work of the HDRC. So we're working closely through governance groups like our community planning partnership, but also the council's strategy board, and trying to position ourselves in the HDRC around the key aspects that go into making decisions kind of at that strategic level, and in terms of developing evidence-based theories of change that lead into proper and good evaluation of those theories of change and tests of change, so that we become more research focused and grow our own skills in that. So I just want to kind of draw the relevance of what you've been talking about to our need to do all of that. But I share Fanula's view that I thought I knew a lot of this, but it turns out there's a whole world out there which I'm not really completely sighted on. So I think I was almost overwhelmed really by the amount of opportunities that we've got as an organisation and individuals to go and find things out. That said, I think our role in HDRC is to support people on a journey of doing these things. And one of the key things, this is a series of seminars, as folk will know, and one of the key things that we'll get into later is around interpretation of evidence and how to use it and aspects of that. So I just wanted to kind of, I don't have a question, just kind of want to make those points that this is absolutely like incredibly valuable for us to grow our understanding of how to access all of this data, and we will be following up around what's available for council officers to do, what support we can provide through the HDRC, and then what next in terms of our journey on that. So thanks again.
Ace. Oh, I feel like that's the start of my sort of Disney villain coming through there. Thank you for that, Martin. I appreciate it. Any other questions? People feel free to raise your hands. While that may or may not be happening, I'll just say our next seminar will be on the 4th of June, and it will be an intro to epidemiological study designs. And I nailed that word, so I'm proud of myself there. Slides and resources from this session will also be available and a recording. We will be creating some more discussion spaces within the council network for continued conversation about getting research active. Any other questions coming through? Yeah, I think we will gift you 25 minutes back of your day then. Thank you very much, everybody. Really appreciate you coming along and look forward to continuing the conversations with you. Okay, thank you. Bye.
Thank you. Bye.